New videos every day.
Hi everyone, I'm Dr. Echols, and we've got Karina here with us today. And you know, a lot of my patients always complain about tightness up around the shoulder area. And when I ask them why that is, they normally tell me, oh, I just carry all my stress in my shoulders. The reason they say that is because they don't understand the biomechanics of the way the cervical spine or the neck works. So Karina's going to help me today to demonstrate why people get tight shoulders and tight neck muscles. Oftentimes they'll go to the massage therapist, and the massage therapists do a wonderful job of helping those muscles to relax, but oftentimes they find that within a few days or a week their muscles are tight again. And so today we kind of want to explain that phenomenon and why that happens. So Karina, I was looking at your neck a little bit earlier, and I noticed that you're carrying your head way forward of what would be considered normal. And let me show you why that causes that tightness. And you also complain that your shoulders are always tight and they feel like they're moving up. Let's pretend that this shot put, which actually weighs about 6 pounds, which is only about half as heavy as your head. Let's pretend that this is your head, all right? And I want you to put your arm up on the chair, and we're going to pretend that your wrist is your neck, all right? Now, in a normal neck, we have a nice curvature in your neck like this. The neck curves. And so if I ask you to hold that ball right there, you could probably sit there and hold that without any difficulty at all, because the curve in your neck is supporting the weight of the ball. Does that feel right? Mm-hmm. Yeah. Now, I'm going to actually straighten your neck out. And now what? Oh my gosh, you better hang on to it, right?
Yes.
What happens to all of your muscles in your neck and shoulders now, right here?
They're really tight. And it's really hard to hold.
Very hard to hold, exactly. So that's exactly what happens to people when the head is not resting back over the shoulders and just resting there. It comes out forward like this. I always explain to people, it's kind of like when you're bowling. If you're holding the bowling ball right here, it's not too hard. But if you try to hold the bowling ball out here, now the muscles have got all contracted. It's very difficult to hold. Well, our head weighs just about what a bowling ball does. As long as it's centered over our head, we don't have any problem. But when that head starts to jut forward, these muscles have no choice but to really contract hard. So you go and you get those massaged and it feels so good, and they may lighten up a little bit, but now we go back to having the spine out of alignment, the head is that way forward again. So what do you think was going to happen?
My shoulders get really tight again and I have pain.
That's right. So it's like a dog chasing his tail. It just keeps going. So the solution is through chiropractic care, we actually correct the spine and we put that curvature back into the spine, have the head centered over that. So now all these muscles start to relax. And that way, when you go to get a massage, not only does it feel good, but it actually starts to stay in place and last a lot longer. And I'll show you an adjustment today that we can do to help kind of put that curvature back into the spine. And can I get your help with that?
Yeah, sure.
Excellent. All right, so we've got Miss Karina here on the table, and I'm palpating, or I'm feeling, of the muscles, the bones, all of the structures of the neck here. And Miss Karina's got a vertebra at the very top part of her neck that's actually rotated over here. And if I put a little pressure on that right there,
ow. Can
you feel that?
Yes.
It'll usually be tender for the same reason that we've talked about in other videos, that when the joint is, the bone is out of place, it's going to start to swell and get inflamed. And don't think that you'll know whether that's happening, because you won't until somebody touches it, and then you'll know it. And that's why a chiropractic examination is always so beneficial, because we can find out whether that inflammation is taking place. So we're just going to gently turn this head like this. We're putting that curvature back in the neck there, and just a light adjustment. How did that feel?
It felt really good.
Felt very good, didn't it? And then we're going to do the same thing over here. Oh, just like that. Perfect. And that will actually give her a lot more joint mobility in there. But even more importantly, we want to start trying to change the shape and the curvature of her neck so that it can actually absorb more weight of her head. Another way that we can help restore the normal curvature to the spine is by using just a very simple orthopedic device like this. And if you'll raise your head up for me, and there we go, lean it back there. Very good. Now you can see from Karina's head that her neck is being pushed up, her head is leaning backwards, and this is putting quite a significant amount of force up on her spine, and it actually helps to restore that normal curvature in the neck. This is very valuable to the doctor of chiropractic because if we can restore that normal curvature in your neck, it will add years to your neck. It will stop that degeneration that's taken place in there and really help. So this is a wonderful adjunctive therapy as well as the adjustments that we do here. Now, when you start off using these, you have to go real slow. You wouldn't want to stay on this more than a couple of minutes. And then you can build yourself up to where you can lay on this thing for 20 or 30 minutes. And over time, just like a good orthopedic insert in your shoe will reshape your foot, this will actually help to reshape your neck too. Hope this has been helpful to you. If we can be of any service to you, my website is jeffechols.com. Look us up and give us a call.